think maybe I'd lost a bit of like the realism that we all have to keep. A year and a half of remission allowed me to think like the other shoe's not going to drop anymore. That was the last big flare. And when this did hit, it was like, oh, this is autoimmune, this is chronic. The shoe always might drop again. And it's really important to remember.
Hey everyone, welcome back to the Not So Sick Chicks. We're so excited that you guys are joining us, and following up from last week's episode of Lance Armstrong being on, we were just loving all of the comments and the support that you guys gave, and hopefully you guys enjoyed it. We really, we had a great time chatting with him, getting to hear his journey of being diagnosed in his mid-20s and what that looked like back in the era of before the internet and before having access to community. So overall, it was a really amazing episode, and we hope that you guys liked it.
Yeah, it was awesome. I think one of the things that resonated the most, at least for me personally this week from the episode, was him saying that he had an excuse for every symptom. And as you can probably tell, that is something that snuck up on me this week.
Yeah, so if you guys are tuning in on YouTube, and you can see Alex is actually unfortunately in the hospital right now. She is in inpatient stay. So we'll get into that a little bit. But yeah, I think, Alex, why don't you talk us a little bit about what got you here leading up to the last couple days?
Yeah, so we recorded with Lance on Monday last week. Felt absolutely fine. Days prior, I had maybe some headaches, some fevery feelings, just like autoimmune cold is what I call it. And it just progressively got worse and worse over the course of Tuesday through Friday, and then Friday to Monday, things had deteriorated very aggressively and very quickly, but we can get into that more later. But really, I was fine one day, and then I was supposedly not fine the next. And I am now inpatient. My Polyarteritis Nodosa, small medium-sized blood vessel vasculitis, which has been in a remission-like state, which doesn't mean that it's cured, but it means it's not growing or spreading, which it hadn't for a year and a half, is unfortunately active again. I spent 3+ years doing pretty intensive immunotherapies and chemotherapy treatments, so this has felt like a sucker punch to be hit with this again.
Absolutely. Those of us, including me, that maybe don't necessarily know a ton about vasculitis, maybe like dumb it down a little bit and tell us what it is.
So think about it as we get inflammation everywhere. If you break your arm, your broken bone is going to have inflammation surrounding it. For me, it's my blood vessels, and there's no trauma that impacts the blood vessels and causes the inflammation to get there. It's my body's own immune system that's confusing my blood vessels with what it thinks is a virus or an infection or a cancer cell, and so it starts attacking myself. And when it does that, it causes a narrowing of those blood vessels. And so if you think about a straw and you bite down on a straw, you can get less of your soda through. And so that soda is going to be oxygen and nutrients. And that means that my skin, my muscles, my nerves, my organ systems, my brain, kidneys, stuff like that, is getting a far fewer amount of oxygen and nutrients, which causes a lot of pain. It can cause immediate onset organ failure. It can cause immediate onset muscle weakness or loss of mobility. And you have to act pretty fast. This is usually I've had like months and months of buildup where there's really clear signs that things are heading in a certain direction. And, we can get into it later on in this episode, but I was ignoring them. And so it felt like a light just turned on one day.
And are these, the vessels, are they like blood vessels all over your body, or is there like certain areas that are more prone to having this like narrowing?
It's a good question. It's all over your body. So you can get vasculitis, the kind that I have, in your eyes, in your brain, in your kidney, in your heart, in your gastrointestinal tract. I am very, very fortunate. It was caught relatively early for me, and we've always stayed relatively on top of the disease. So the furthest I've had is skin and nerve involvement. So I don't have any kind of organ failure. I don't have any kind of long-term mobility impact, but I am in a certain stage right now that, you know, I'm struggling, and there's things we have to get done.
Right. So what are some of you mentioned like there were some signs that you may have been ignoring like for months maybe, like what are some of those you think that, like, reflecting back now, like what are some things that have happened that you were like, maybe that was a sign for this happening inside?
Yeah, so I think first and foremost, I got to set the stage that like I could not feel my legs and have not been able to feel my legs since November of last year. So typically a big red flag for me in a flare-up is pain. I get nodules, which is these areas of vessel inflammation that swell up, and it kind of looks like a marshmallow underneath your skin. And I get them on my feet, and that's historically the only place I've gotten them, or in my nerves deep inside my body though you can't see them. I started having those. In February, caught COVID, and that's kind of when things tipped. I'm someone that when I catch a big viral infection like COVID or strep or the flu, I stop responding to my autoimmune medication. So historically, I would be someone who's really on top of this and advocates and tells their doctors I need to be on something new immediately. I guess I was in kind of like a la la land bliss state because I'd been in remission for a year and a half. I'd had symptom flares, but not disease progression flares. So I chalked it up to something like that. So I went and got steroid shots in my hip, or 5-day steroid oral dose packs, steroid injections into the nodules in the bottom of my feet, which is incredibly painful. And I thought that was enough. I also had a lot of life things going on. I had some family health crises, obviously my job transition. And I thought, okay, I'm tired. I'm more fatigued. I have worse brain fog just because there's a lot of balls in the air right now. When I'm also stressed, I eat less. And so I didn't notice that I was having a massive, depletion in my appetite and was losing weight. I thought the headaches were from staying up too late or having too much caffeine. And there's a lot of good stuff going on in my life right now. So I was focusing on the good, which is great. And I think it's something we should all do. But I think maybe I lost a bit of like the realism that we all have to keep. A year and a half of remission allowed me to think like the other shoe's not going to drop anymore. That was the last big flare. And when this did hit, it was like, oh, this is autoimmune. This is chronic. The shoe always might drop again. And it's really important to remember.
I'm sorry, honey. It's tough, right? Because you were like living life, and like since I've known you, like doing the most that you've done and being
Absolutely.
like so active, and being active in like your career and other projects and with family and everything, and just traveling. And so it makes total sense that you were like, okay, because I'm doing all of these extra things, like that's why I'm having these new additional symptoms. And you just thought it was like due to fatigue from that and not from the disease.
Yeah, it's like what Lance said last week. Like I had an excuse for everything, looking back, literally an excuse for everything. And I think the day I found out that vasculitis was active again, I called you, and like, I think this is something that everyone resonates with. It's like the first thing that you do is you self-blame. And I thought, what could I have done to not have gotten sick again? And what did I do? And it's really hard to live with that, because the reality is this could have happened even if I had been super proactive. It could have happened in a really low stress time. There is no rhyme or reason for why these things hit or when they hit. And I think, your support system and your community and your family, those are the people that are responsible to make sure that you don't stay in that feeling. You certainly did not let me sit in that, and I'm very grateful of that, because I think that's when you start to spiral into depression and like hating your body, when at this point you have to love it harder because it's doing a lot.
Absolutely. It's like, I think the rational part of our brain is like, it just goes to like, what did I do to cause this? Like, what could I have done differently? And that's like just not the case, right? It's just like these things come and go, and that's the issue with these chronic illnesses. Like they will come and go, and yes, you can try to mitigate and reduce stress and things like that. But it's not a one-to-one correlation there. And also, like, you have to balance living your life and doing the things that you want to do. And so, yeah, like, you may have like less of a flare if you like literally don't do anything anytime.
But then who knows?
But then, yeah, you may still have it. And like, then it's like, also, what are you doing with your life then?
Yeah.
And so
you've given up on the aspects where you could have had a good part.
Exactly.
Before we dive in more to the story, you had also a big week, and I want to give that a little bit of light because you've also shared the sick chick anxiety. Can you let everyone know what you were waiting, breath and whatever that phrase is, hand and breath and wait?
I have no idea what that phrase is. I've never heard it.
I think I just made it up. You were really excited for the phone call.
Yes. So I have been on a new treatment since, was it early March, I think?
I think so.
So 2.5 months. So that was my third treatment that I've started. So I had my first set of scans on it this week. And we did CT scans of like my entire upper body. So like abdomen, chest, spine, that whole pelvic, all that region. And going into scans is always interesting, right? So it's like there's so much buildup of like you think you're feeling okay, but then you start thinking about all the things that you haven't been feeling well about. Like I've had a lot of fatigue on this. I've had a lot more hair falling out. I've had a lot more nausea,
pain,
and so pain as well. And it's, it's like, well, am I having those symptoms because the medication is working, or am I having those symptoms because the medication is not working and my disease is worsening?
Yeah.
And you really don't know the answer to that until you get the scans. And so we did the scans, and I met with my doctor, my oncologist, and essentially it's good news. It means what happens is like they're stable. So essentially it's exactly the same as what we saw last time. So the lesions that are in my my bones and in my liver have not grown, but they also haven't gotten any smaller. But there's also no new ones. So overall, that means that the medication is doing its job from having the disease progress, which is great. So definitely like a sigh of relief. I think like best case scenario is like if the lesions get smaller or go away. And this is like second best scenario, which is like they are stable. And then a bad scenario would be like if there's new lesions appearing or new spread that they're seeing.
Is it possible and does your doctor think that like it has to stop spreading first and then they start to shrink? Like, is this phase one of maybe it moving in the right direction, or is this just like a possibility?
So I asked her specifically, I said, were you expecting things to get smaller? And she said, I'm happy that they have not gotten bigger. And so I think we're, 10 weeks into this medication, she's happy the fact that at least the growth has stopped. And she said when we scan again in a few months, hopefully at that point we'll see some reduction. But even if it's still stable at that point, that means I get to stay on this treatment. And kind of the name of the game with like stage 4 cancer is just being able to stay on the treatments. So whatever treatment you're on, if you can stay on it as long as possible, that's the best you can do. And the scary part is like if you go from like treatment to treatment to treatment, eventually like you run out of options. And so the longer you can stay on any one treatment, the better it is for you.
Got it. Okay, that makes sense. Can you ever return to a treatment, or is it like if you fail it once, there's not a chance again?
No, I mean, I've like thought about that, and I've asked that as well. Like, why wouldn't we like go back and try something?
Yeah.
But essentially what happens with these cancer cells is that they like mutate and they, quote unquote, get smarter. And so once they've adapted
cancer cells getting so smart.
When they've adapted, it's proven that treatment's not going to work.
Got it. Okay.
I've also asked them, like, why can't we just give all of the treatments at once? Like, let's just, like, put them all in there. And they, laughed and said, that's just, like, highly toxic and...
Just nuking your body.
Yeah.
Yeah.
Give them all. But, yeah, I think I'm happy. I'm relieved.
Good.
I But like you said, it's like that feeling of like waiting for the other shoe to drop.
Yeah.
Like that feeling just like always lingers in the back of your head. And that being said, I want to enjoy like my summer now and like go travel a bit and do fun things. And I want to hopefully just get to a good mental space where I can put this behind me, or at least like not think about it for a while.
I hope you can too, because you deserve it.
Yeah. And it's crazy that, you know, like for people listening that don't have a chronic illness, like it's hard. Like it's like, to me now, it's like I would have so much like love for life and gratitude, you know, if like I didn't have this like looming thing over my head. So if you're listening and you're healthy, like just be like so grateful, because it's honestly like such a blessing that unfortunately like you don't know how blessed you are until it's taken away from you.
Absolutely. That's said perfectly, Biz.
But yeah, that's been my week. Everything else is it's been good. I'm actually heading over to Mexico next week for a Joe Dispenza retreat, which you can talk about a little bit more later. But I'm super excited. His work is something that, you know, I've been into for the last 6 months or so, and I feel like I'm in a really good place, especially with these scans coming out stable.
Yeah.
That I feel like mentally, like, okay, let me do, like, what else can I do internally, like mind wise, to see how we can improve my health. So I'm excited for that.
I love that when you find, okay, I'm not as scared, you are like even more motivated to make yourself better. And that's such a beautiful thing. I think it's a really hard place to get to. And so I'm so proud of you that that's where you are.
I mean, I think honestly, I love to do the scenarios thing in my head, right? So I'm like, okay, like if the scans come out this way, then I'm going to feel X, Y, and Z. And if the scans come out like this, I'll feel this, and then I'll do this. Like I literally make a decision tree in my head.
Amazing.
For everything. Which means like my brain's always on overdrive.
Finance girl, can't take her out of the Excel sheets.
So I thought, you know, if the scans like didn't come out well and I was going to Joe Dispenza, like what would I feel like? And I kind of feel like at that point I'd be like, okay, like this is like officially not like my last chance, but like a really big effort that I need to make in this retreat to see if I can turn around my health.
Like a Hail Mary.
Like a Hail Mary, as far as like what's in my control type of feeling. Versus like now I actually still kind of have that feeling, which is good.
Yeah.
Like I'm not not motivated anymore because my scans came back stable. I still feel like, okay, like there's like, I have a chance to go now enjoy this in a less like scared way.
And a less pressured way.
Less pressured way. Exactly. So, I'm really excited. I think it's going to be, I've never done like a week-long retreat before. And so I think that in itself will be fun, just to focus on myself. I'm probably going to try to do like a digital detox and, you know, turn my phone off and just really try to be present there.
I love it.
Yeah, I'm excited.
I have this like vision of you coming back from the retreat and your whole body just like glowing and levitating and being like, I am one with oneness now.
Yeah. I have this weird thought. I'm like, I'm just not going to come back. I'm just going to be like, bye guys. I'm just going to live on a beach now.
We'll just mail Bella to you.
Yes.
And your podcasting gear.
I forgot about Bella.
That's how at peace you are. You're like, I'm already with her mentally.
Yes. There is no time, no space.
No, it is all one. That's awesome.
Okay, so speaking of mental health and space, like how you being in the hospital, like where's your mental health at? Like how do you feel?
So I would say so I'll roll back before the hospital. Friday, I started having like this, I'll roll back further. Tuesday last week, I thought I had a DVT and I went into the hospital.
What's a DVT?
A deep vein thrombosis. It's essentially a blood clot. If you don't catch it, if you catch it, you go on blood thinners, you're good. If you don't catch it, it can kill you. They are in your...
Like it'll travel to like an organ and...
to your heart and just done. So they take it pretty seriously. And because of vasculitis, I am more prone to develop blood clots because that's just how lucky I am. So I was having pain in my calf, warm to the touch, kind of shortness of breath. And I would say for the first 3 years of my diagnosis, anything like a weird rash would make me want to go to the emergency room, and like was pretty hypochondriac-y because I was so scared of the disease progressing. I would say over the last year and a half, 2 years, I'm like, a rash, I'll put some steroids on it and check it out again in a week. I don't get all worked up and reach out to all my doctors anymore.
Because you've done that enough times that you kind of know, like, these are probably the things that it's going to end up being.
Exactly.
Is that right?
Exactly. Yeah. And I also have realized, like, there's few aspects of this disease that could kill me overnight. And that gives you some peace of mind. Regardless, I was like, I think this kind of is a DVT. I maybe had one in 2018. This feels kind of like that. So I reached out to one of my specialists, and she said, you're going to hate me, but you need to go to the downtown ER. The downtown ER is where all my specialists have privileges, so that made the most sense. Unfortunately, there was a cyber attack on the operating system of the hospital, so everything is on paper, which means everything is moving so slow, and they do not have access to your medical records.
Oh, wow.
So someone like me that has a disease that 1 in 3 million women our age have, that most, medical students have read 3 sentences about in their entire training, that's scary to me, honestly. Thankfully,
so
though,
are these guys like on like Google on their cell phones, or what are they doing?
Yes, I have seen professionals take out their cell phones and Google what PAN is in front of me, or have said, look, you're the expert here, what do you guys do? Which at this age, I'm like, I know what to do, so I feel okay-ish doing that. At 24, I was like, are you shitting me? I have no idea. I didn't go to med school. I don't know what's going on. So thankfully, I had like a really nice attending that brought me back, and my blood pressure was pretty high. I was shaking, crying. When I am in a lot of pain, I go dead silent and I just white knuckle. And I've chipped my teeth doing this before, and I just try to like grit the fuck through it. When I was chatting with her and told her, I have PAN and CRPS, she was like, okay, we need to get her into bed immediately. And it was like, boom, 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 cascade of actions. I've never had that happen before in my entire 5 years of fighting this, that someone recognized what these things were and prioritized me as a patient.
Tell us what CRPS is.
It's complex regional pain syndrome. And essentially what that is like, there's a great Netflix documentary called Taking Care of Maya if you want to learn more, but it's called like the suicide pain disease. You essentially feel like your body is lit on fire, being bit everywhere by fire ants, and that you have like a red hot pole just like stabbing you everywhere. It's pretty bad. I've passed out and had seizures from it before.
Wow.
So
is that that pain device that you had, is that for CRPS?
Yeah, exactly.
Okay, got it.
I think I skipped forward. So Tuesday in the ER, DVT, get an ultrasound, get all the testing done, and the doctor comes in and he's like, hey, you have narrowing in 2 places. This looks like pre-DVT, but it's not a DVT. We think that this is your vasculitis and it's active again. They send the stuff to my specialist, and my specialists are like, yep, this is vasculitis again.
What was the location of these 2 narrowing?
In my right calf, and I have never had it there. I've only had it in my right and left feet, everywhere, like 20 nodules in my right and left feet, but only there. And in the nerve behind my right knee.
So is that like where you were having the most pain, or no?
And that's what was scaring me, is that I was having the most pain in places I had not had that level of pain before.
Interesting.
Yeah. So we get discharged from the ER at like, I think 5 a.m. And the next 24 hours, I was just a puddle, like crying nonstop, beating myself up that I did something wrong, that I should have acted faster, scared. My rheumatologist is on maternity leave, so I was like, I don't even have my standard care team here to help me navigate this. It just felt like the rug got pulled out from underneath me. And I wish that I could have done things differently, sooner and faster. So then by Friday, I get a hold of the on-call rheumatologist, who is actually a vasculitis specialist. And I said, here's what's going on. Here are my symptoms. And he said, let's get you on really high dose oral prednisone for a week. And let's go from there. Like, let's not buy which future we think it's going to be. Let's just figure it out live. So we do that. And by Friday evening, I'm now like 3 days into this high dose prednisone. And Cooper and I usually go on like a 30-minute to hour-long walk almost every night with the dogs, depend if I'm feeling okay enough. I went a block, and it took us almost 30 minutes, and I was shaking. I was in so much pain during it.
Wow.
Which obviously was terrifying, but also just like flashbacks to 2019 where I lost mobility really fast. But in 2019, it was over the course of months, and this was over the course of 4 days. So Saturday, I'm like, we're not doing anything. We laid on the couch. I put on my compression pants basically the entire day, watched a shit ton of funny movies, went to bed early, ate good. Sunday night, I started feeling worse. Pain got a lot worse. And Cooper and I were having dinner with some friends over at our house, just sitting on the couch, and I realized I kept dropping my fork and I couldn't hold my fork properly. I didn't want to scare my friends. Their AC had gone out. They were staying with us. So I was like, I'm just going to sleep through the night. I think I'll be okay. Monday morning rolls around, and I'm like, this is going south way too fast. I'm scared now. So we call the rheumatology department. It's a holiday, so get the on-call line. He calls me back about an hour later and is like, Alex, you got to get to the emergency room and you're going to be admitted now. We probably need to start some kind of new medication there, and we also need to make sure that there's nothing else more serious going on. So thankfully, this is not our first rodeo. So as I laid in bed having a mental freak out of this is happening again, I haven't been an inpatient for my vasculitis in years. The last time I was in the inpatient setting, it was for 14 days. It was traumatic and it was awful. So getting myself prepared for that, also like having to say goodbye to the dogs, which was really sad. Cooper's running around the house and he's packing all of our oh shit stuff. So that means, you know, underwear, socks, sweatpants for him for a few days, boxers, socks for me for a few days, exit clothes for me. So like sweatpants, a bra, shoes. Don't forget shoes for your way out.
Yes.
And then our like entertainment and dop kit stuff. So that meant toothbrush, hairbrush, deodorant, face lotions, anything that like makes you feel a little bit more, have a little bit more self-care in the hospital, maybe a face mask, books, chargers for laptops, charger for phones, headphones, and then sleeping things. So eye mask, earplugs, all the good things. And then my new hack is I bring my compression legs by Theragun. Unreal. That shit made me feel so good when we were so we had to wait in the ER again for about 8 hours, and it made it significantly better. I mean, I looked like a clown just sitting in an ER bed, but I don't care. And then we were off to the races.
Were the compression legs your biggest like tip to bring in?
I think so. And then a pillow, the pillow that I sleep with, a blanket, and then I have the Skims duvet robe. I bring that and I use that as like the liner on top of my hospital bed, so it gives it extra cushion.
Right.
Way more comfy.
Yeah, totally. There's definitely like not a lot of padding on those hospital beds.
No, there's really not, like at all.
I wonder if you can ask for 2.
I think you can, but I will say the padding on the hospital beds is far better than the padding that's on the bench that Cooper has been sleeping on for the last 5 days.
I know. Yeah. What are things that he's brought in to make it more comfortable for him as a caretaker?
So great question. He brought in 2 pillows, 2 things of blankets for himself, a few days of clothing changed. And that's it. My friends and family, my sister and brother-in-law have come in for like an hour or 2 almost every single day to give Cooper some relief so he can go home, shower, see the dogs, just have a minute to himself, because it is, however hard it is on the patient being in here, you're in action mode. You're also probably on pain meds. Time passes a little differently. when you're the one standing there watching your significant other scream cry with a CRPS flare-up for 3.5 hours that no one is giving medication for, that takes a toll on you for sure.
Absolutely.
Yeah. So I'm really thankful for our friends and family that have, recognized that and have stepped in to help Cooper, have some moments to himself.
I think that's awesome.
Yeah.
So speaking of that, like since you've been in the hospital, like how have you felt supported by your friends, family, community overall, like other than the ones that are there in person? Like what have people done that you think is helpful to you? And, what are things that you think could be helpful to you?
This is the best outpouring of love I've ever gotten during an autoimmune flare in my life. Like I could cry about it right now, actually. When I was first diagnosed, I was 24, and my friends did not understand what a severe autoimmune condition was. I had one friend that would visit me in the hospital, and that was it. And the rest of them didn't want to talk about what it was that I was sick. They would say, like, honestly, some pretty shitty things, like that I was a flaky friend, even if I was in the ER being sick. There just was no compassion. Yeah. And I think, naturally in everyone's life, you shift away from those kind of friends. But when I was 24 and in a crisis, I didn't have that evolution of friendships to turn to.
And you take what you get, right? You're at that point, you're not sitting there trying to choose who to be friends with. You're just trying to get through it. So whoever's there and shows up in whatever way, you take that.
Exactly. And then this go around, over the last 5 years, I have had a major friend rehaul, and the friends that I do have now are some of the most like selfless, loving, beautiful humans I've ever met. You and I were, miles away and FaceTiming, texting every single day, sitting in the muck with me. I had my brother in London and his wife calling and FaceTiming me every single day. I had all of my friends around the world texting, sending memes, calling me, just checking in, and not just to me, but to Cooper too. And that was really, really special. Really, really special. And then my local friends, they made sure that Cooper and I had food that was not just the hospital food. They made sure that our dogs were taken care of and didn't ask any questions, just took it totally off of our plate. They were here last night and saw that Cooper didn't have a great sleeping situation. So they came and they brought him a mattress topper today so that he can sleep on that for the rest of the week. I think it's the people that take a second and look. I think it's really easy to say, how can I help you? Because no one knows what to do. It is so beautiful when you can sit and look around on what that person's doing. One of the best questions I think that leads to this kind of outcome is, walk me through your day instead of how are you doing? Because then you can start to hear the pain points without having to directly ask them, and then start finding solutions that could be really good or helpful, supportive during that time.
Yeah. I think people will often text and be like, what can I do? And I think to your point, it's hard when you're in it, it's hard to really think of the things you need. But if someone asks you what did you do? What was your day like today?
Yeah.
Then they can pick up on what is needed.
Yeah.
That they could step in, and whether it's emotionally or whether it's something physical they can provide to you.
Totally.
To make it more comfortable for you.
I think that's a really fair point. And it takes the burden off of your shoulders of having to, think outside of just your immediate goal of staying alive and feeling better.
Yeah. And I think when you're in that hospital bed, it's hard to think what could make this better, because it doesn't really it seems like nothing's going to make it better. So but there are things that can make it more comfortable, right? The
Absolutely.
whole experience.
Absolutely. Even just if you do go visit someone, holding their hand. If they are in a low pain state, holding their hand or giving them little head scratchies or back scratchies means the world. You're not getting poked or prodded by a needle or shaken in a really loud scan machine or probed or whatever. It just is a kind touch. And that means a lot.
That's awesome.
Yeah.
Has anyone done anything that you're please stop doing that?
Oh my God, yes. I would say not so much in oh no, actually, yes. So I had a few people slide into my DMs. I'm posting my story online, obviously. And I would say there's one thing of oh, that's happened to me. These are some of the things that worked for me. I'm thinking of you, and trauma bonding. versus, oh my God, this one time diatribe of what they've gone through. And you're like, I'm just trying to get through literally my own shit right now. I'm sorry that happened to you 10 years ago. Now I am now carrying the weight of that happening to you. And I need to now focus on that, which maybe that's just like, cause you and I are people pleasers and we're like, okay, I'll be there. I'll turn and help you with that. But it's like, that's not helpful right now.
Yeah. I think it's probably like hearing you say that, it's like, I get that too. And they're probably coming from a space of like, that seems like a bonding moment versus what it comes across to people who are people pleasers. It's like, it makes us want to step in and now try to help you and talk through your problem. So
yeah. And I'm okay with I'm okay with the trauma bonding, and I'm okay with the, unsolicited solution giving to a degree. I think when people tell me like, I heard that this one person's cousin's hairdresser drank this one thing and they were cured, that makes me feel shitty because I'm like, well, one, you gave me 0 descriptions of actually hunting that down. 2, it also makes me feel like my experience is invalidated because I don't have that disease.
Yeah, and people just try to draw comparisons where it's not a one-to-one comparison.
No, it would just be better if people sat and just, what's your day look like? How's your heart feeling? How's Cooper doing? What are the 3 things that were really good today? What are the 3 things that could have been better?
Yeah. That's awesome. So that's a great segue. So like what are the most positive things that have happened while you're in your hospital stay?
Hands down, preparedness. Being able to have all this stuff, like Cooper's allowed me to have some like TLC hours sprinkled out throughout this week so far. So like yesterday I had my first bed bath. You do not leave your bed. They tuck towels around you, take off your lovely night hospital gown, which the Loft has now launched a line that looks like this.
I know. I saw that. I'm going to get one. Actually, it doesn't make sense for us to get one since we get them for free.
We already have a few. It was a questionable. I would like to know the background story of this because I'm sure it's funny.
Yeah.
But you keep this on and then they like unbutton the top parts and then wipe you down with like a kind of like a hobo style bath. And then they put this hair net on your head and it is full of shampoo that doesn't need to be washed off. And they gave me a nice little head scratchy massage and just getting clean. And then they like roll you to one side, unstrip the bed, roll you to the other side, unstrip that bed and put new sheets on all in like one motion. It just felt really nice to have like fresh cleanness. And then Cooper was a saint and like dry brushed my legs and not my legs because that would have been painful. Dry brushed my arm, my left arm and my back and put lotion on for me and like just made me as comfortable as possible.
Good.
So I'd say
that's awesome.
That was pretty epic. And then the FaceTimes and friend visits, like anything to get me laughing right now is a godsend and very welcomed.
Good. How's your sleep been while you've been there?
The last 2 nights, great, because I had to have CT scans. I'm claustrophobic, so they gave me IV Ativan every single time. So I slept great those 2 nights. A little bit worried about tonight because I will not be having that.
You should still ask them. Just ask them for Ativan.
Yeah, I think I might. I'm not into I'm already on 100 milligrams of prednisone, so I've got to do something to offset the sleep.
Yeah, I mean, I think you're similar to me, so I don't love to just take things just to take them. Like, yeah. I'm a little bit careful, especially when you're on a lot of medicines. Like, you don't want to just keep taking more and more, but you're in a really high stress situation right now, so you're going to need some help sleeping. And I think Ativan, if it's working for you, stay with that.
And I think it's like the perfect saying is the hospital is not for sleeping or healing. It's for identifying what's wrong and getting on something that will hopefully help you heal. But you don't sleep here easily. That's why the earplugs and eye masks and probably Ativan are pretty much essential.
Are doctors and nurses coming in super early to check on you?
Yeah. So the first night I was getting meds at 2 a.m., vitals at 4 a.m., first round at 6 a.m. So I slept, I think, 3 hours the first night. I was pretty cranky. And I think I mentioned this earlier, but the system is down. So all of the charting is being done on paper. And then when one shift ends, they pass that paperwork to the next team. I have neurology, rheumatology, palliative care, and internal medicine all rounding on me. and ophthalmology and neuroimmunology. So those people all have their own paperwork. So before palliative care came, all of those different teams were trying to make a pain plan for me. And I had some bold residents that decided to dox or cancel some of my pain medicines that had been agreed upon. So I would wake up after like an hour-long nap and all of a sudden not have access to any pain meds besides Tylenol and Toradol. And as I described what the pain feels like, those things don't really touch that.
That's not enough. Yeah.
No. And then there were really uncomfortable conversations about, does it make you feel bad or guilty to have to take pain medication? And I felt very uncomfortable being asked that question by a medical professional off the first place.
Oh, wait. They asked you that?
Yeah.
Say it again. I feel like I didn't even process that.
Do you feel guilty having to take pain medication?
That is so bizarre.
And my response was, I think everyone in the world probably feels uncomfortable having to take pain medication, but I only take it when I need it, and I need that right now. So no, I'm not feeling guilty about needing to take a higher amount of pain medication right now.
What was their reaction?
Oh, okay, that makes sense.
That's so strange.
It was really strange. Really, really strange, and just deeply upsetting. I think there's already a lot of sensitivity around taking or not taking pain medication for each person. I mean, we live in a world that, because of the opioid crisis, like there's a lot of tension and dislike for use of it, but there's a time and a place for it. And I can tell you, during a CRPS flare-up, an active vasculitis flare-up, that is a place.
Yeah, I agree. I feel like there's a lot of shame around it.
Yeah.
Like you feel like you shouldn't have to take it. And then I do think some doctors will, I mean, because they're cautious, obviously, right? There's like so many protocols and, scary things that can go wrong if you take the wrong combination or too much of something. That being said, but like you're in a setting where you need it and it's controlled and they're the ones controlling it and coming up with the plan. So that's really unfortunate they would ask you that and make you feel more shame on top of already being in the hospital.
I agree. And then there was a lot of, so pain is not really taught a ton in med school. You have to put in the time and work to understand what that is and how to manage it. So in the ER, my pain was very, very well managed. Part of that too is like they just have more staff so they can keep better eyes on you, so they're more comfortable giving you a higher amount of pain medication. But when I got moved to inpatient and admitted into the hospital, I did not have pain experts making this plan. So I went from 1 milligram of Dilaudid every 2 hours, I think, there, to 0.1 milligrams every 4 hours, and was told if I needed more than that, then I needed to be in the ICU. In my experiences, including a massive, massive spinal surgery, that was not the case. So I think that there was a level of discomfort. It also made it sound like there was a lack of belief in my pain protocol and what was necessary for my treatment, which made me really, really self-critical. So that was really difficult, and it made me frustrated, and that kind of anxiety and stress, when you're already in a ton of pain, is it kind of breaks you, to be honest. So at that point, one of my friends texted me, and she was like, reminder that you are in charge here, and you can fire anyone that's working for you to get someone that understands and can work with you better. So ultimately we ended up doing that, and palliative care, which is a specialized pain group, came in and took over my pain protocol and plan. And since then, I have had a much smoother hospital stay. I am not having 3 to 6 hour long, breakout periods of CRPS where my blood pressure is 200 over 130, heart rate well into the 140s. It's made it tolerable, and that's a world of a difference. So reminding yourself that you are your own advocate and that you are also a client is really important, I think.
Totally. I think so palliative care is different than a regular pain management doctor
Correct.
coming in. And so I know in my situation, I only deal with palliative care because it's what palliative care is it's basically making you comfortable, not trying to solve the issue,
Yes.
the underlying issue. they're more about making you comfortable.
Yeah.
And I really think like going forward, like you should really just request for palliative care.
I think so too.
Pain management doctors, because you're not trying to, your pain won't go away with like fixing, like it's not a surgery fix. It's not a anything fix. And so you just need to be made comfortable.
I totally agree. And I don't know why I had always had it in the back of my mind that palliative care was only for stage 4 cancer or bone cancers or XYZ. And this probably goes back to the fact of like, I have normalized having really severe autoimmune diseases my entire life. And so sometimes I don't put myself in the bucket that quote unquote deserves palliative care.
Right. And also, I mean, it's unfortunate that you're the one that has to choose that. Like it's unfortunate that your diseases don't already fall into that. Mm-hmm. They're not treated the same, but your level of pain is drastic and it needs to be treated. So
yeah, I totally agree. I think I am going to pursue that from here on out. This has been a really good like relearning curve for me. I was a bit rusty, so glad that we have some new tools. And I'm glad that we can just kind of move forward now for next steps.
Good. So what are, have they told you like, what are your scans looking like? Like what are next steps? What, when will you possibly be discharged?
So we got all of the MRIs and CTs back, brain, spine and neck. Those are the most concerning. I was terrified if I had vasculitis in my brain. Thankfully, those all came back clear.
Good. Awesome.
Yeah. Thank you, God. I had about 4.5 hours of ultrasounds done over the last 24 hours. The DVT ones all have come back negative, which we thought would come back negative. Those ultrasounds were supposed to also be vascular ultrasounds, but there was, because of all this paper issue, miscommunication, and the ultrasound tech woman came up and refused to do anything other than a DVT scan, and made it quite an ordeal. So had to do a repeat ultrasound this morning. Still waiting to hear results back on that one. Either way, it won't change our action plan. And so the action plan is to start something called IVIG. It was supposed to be last night, but hopefully it'll be tonight. Just waiting on the pharmacy to get it ready. They are massive bags of liters, so it takes about 8 to 10 hours to infuse this medication in. I wish I was more of an expert on it right now, but I will be by our next episode. And my understanding currently is that essentially healthy people can donate their blood plasma. They take out the immunoglobulin from that, mix it all up, and then they put that in me. And the hopes is that my body can start mimicking and replicating the way immunoglobulin is supposed to act in one's body instead of attacking myself. So I will have 2 to 5 days of these infusions back to back to back. At that point, I will, fingers crossed, hopefully be discharged. Resume normal pain management with my normal pain provider. Restart physical therapy because I have lost so much muscle over the last week. I have to kind of relearn how to walk again for the second time in a calendar year. And then in a couple of weeks, I'll start rituximab, which is a immunotherapy also used sometimes in the treatment of cancer. It just depletes part of your immune system. I want to say it's the B cells, but don't quote me on that one. Lowering your immune system. You get it once every quarter. The goal would be to stay on it for about 2 years. The reason that we've been having to kind of navigate what meds that we want to be on is, Cooper and I had a plan to start a family at the end of this calendar year. And we had made the decision about a year ago to go on less aggressive autoimmune medication so that I would have a lower toxic burden onto my uterus and ability to carry a child. I can't get pregnant myself, so we did IVF back in 2020. We have 2 embryos, 2 chances to have a child that is of our own genetics. I would like to carry one if I can. If the first one does not implant, we will have a surrogate do that. that said, this has had a layer of additional hardship and mental sadness, because it feels like every time we get close to having this green light of starting a family, it gets taken away from us. And if there's anything I've known since I was a little kid, it's that I wanted to be a mom. And I'm really sad that I have to go through these toxic medicines again. And then the half-life is about a year. So it'll be another 3 years until we can even consider welcoming a child. And I know I'm young. I know we're super young and have plenty of time, but
that doesn't change how you feel, though. Yeah.
No, and I think it's easy to say, it's easy for outsiders to say, like, you're so young, you've got plenty of time, but the reality is, like, I want it on my own timeline, damn it. I don't care what other people think. If I could have been a mom at 24, I would have been a mom at 24. Yeah, it's just kind of heartbreaking because, like, I know we have those 2 little embryos there, and I can't wait to meet them, or one of them one day. But I know I've got to get myself right first.
Absolutely. That's really, I mean, I totally get it. It's not about, yes, you're young and what, you know, yes, quote unquote, you have time, but you're ready to be a mom now. And
in the way that we want.
Yeah. And that the fact that, like, that goalpost is moving further and it's not by your choice is really heartbreaking. Yeah.
I think a lot of women have spoken out about how, like, their birthing plan not going according to plan. And this is like that on steroids, not even getting to be able to determine if we can, you know, conceive on our own, if we can carry on our own, if we can have a baby that's genetically ours on our own. And, you know, you and I will do an episode on this one day because we share that pain of motherhood looking really, really different for us because of our health.
Yeah. It's unfortunately a journey that a lot of us are going through, and it's sad and it's heartbreaking, and it is nice to know that, well, you're not alone. Yeah. And, you know, we're all here for you, and anything that any of us can do, you know where we are.
I'll probably just get another puppy, to be honest.
Yeah, I think that would help.
Yeah. Dog mom for life.
Just don't get a cat.
I don't think I will. I don't think I have cat energy. But damn, do I have dog energy.
Yes. Good. Are the doggies going to come visit you in the hospital?
Yeah, so they came yesterday for the first time. It was everything and more. Like, that is better than Xanax, hands down.
Yes. Yeah. The puppy cuddles are the best.
Yeah. And Teddy gets so excited. He, like, his whole body wiggles, and he, like, does this happy little cry. Oh, God, it's so cute. I can't wait to see him again. He's coming again tomorrow. And Knox, of course.
Good. Awesome. I love that.
Me too. Well,
my love, thank you for, like, sharing all of that with us. I know, like, even you recording in the hospital, like, that means a lot. And, you know, it's just, you're keeping it so real and authentic. And I'm so grateful for that. And I think people listening in will definitely appreciate that and relate to that as well. So thank you for doing this.
Of course, it was really, really important for me to show what autoimmune flare-ups look like. I think, you know, there's symptom flares, which is what everyone talks about most commonly, like, oh, I'm in a flare-up. But disease progression flares are the serious side of autoimmune diseases, and they're hard. They're not well understood, and you don't get to see them. It's not well understood or publicized. So it was important to me that people could see that this is what it's like.
Yeah.
Thanks for giving me the space to do that.
Of course.
Love you, B.
Love you, honey.
Thank you guys so much for tuning in again. The next week, Bisma is going to be traveling to go see Joe Dispenza, and we cannot wait to hear what she has to say when she gets back. I will obviously be resting after this lovely vacation I just took. So we have a pre-recorded episode we cannot wait to have you guys listen to. It's about all things food and nutrition. And hopefully when we all get back together, we can share some of our favorite recipes that are part of that whole episode.
Thanks, everyone.
Love you guys.
Thanks for listening to another episode of the Not So Sick Chicks. Remember, new episodes drop every Monday.
Subscribe and rate 5 stars. And of course, send this to a friend who is a sick chick trying to be a little less sick. We're all in this together.
Follow us on socials at the Not So Sick Chicks.
And we'll see you next week.